Hormones are beneficial for women. They're also beneficial for men. Do men need estrogen? Yeah, they do. Do we give men estrogen? No. What do we give them? We give them testosterone. Testosterone does convert to estrogen in men, but also testosterone has a lot of other health benefits. As you get older, you deteriorate. You don't feel as well. You don't function as well. Would you like to have better strength, energy, endurance, maintain your skin, muscle, bone, and fat metabolism like you had when you were 20? You can't now if your testosterone level remains what it is, which is probably about 25% of what it was when you were 20. Testosterone, when you lose it, it adversely affects heart function. It adversely affects lipids. If you replace testosterone, it lowers your cholesterol. It increases the good cholesterol, and it lowers all bad apolipoproteins that tend to carry cholesterol. None of the cholesterol medicine that we prescribe does this. The lower cholesterol has no effect on the good cholesterol, has no effect on the lipoproteins. It also doesn't increase fat metabolism or protect bone. Testosterone in all the studies to date, of which are 50 years, protects against heart disease. It protects against Alzheimer's. How? It converts to estrogen. It's the estrogen in the brain that is protective. Abdominal obesity. As we get older, we get fatter. We get fatter because our metabolism falls. Why does the metabolism fall? Because we lose our testosterone, which adversely affects muscle. When you lose muscle, you lose metabolism, therefore you gain fat. If you want to maintain good muscle, good metabolism, and less fat, your testosterone level needs to be at the upper end of normal for a younger man. If you want to improve your well-being and your confidence, motivation, cognition, and memory, you need to have just as much estrogen as women do. And you can get that by taking testosterone because it does convert over to estrogen. And a lot of these beneficial effects happen to be related to estrogen that is converted in the body from testosterone. Low testosterone causes depression, lassitude, fatigue. I just don't feel as energetic and, shall we say, motivated as I used to. Well, that's because you're getting old. Not the answer that you want to hear. What you want to hear is, we got the solution for that right here. There's a beneficial effect in your health and your well-being. And for those men that don't understand why they lose libido and can't get erections anymore and have poor sexual function or not the sensitivity that they did, it's because your testosterone levels are low. What is the #1 test to diagnose low testosterone levels? Well, you men realize when you were younger, when you woke up in the morning, you had an erection. Now when you wake up, you realize, not there anymore, is it? That's because your testosterone level is about 1/5 of what it used to be when you were younger. When you do replace your testosterone level back to the upper end of normal, you'll see an improvement of libido, return of erections, and improvement of sexual function. There's feel-good effects. There's health benefits. Do women need testosterone? Yep. When you go through menopause, you lose estrogen, progesterone, and testosterone. Doctor, I have no energy. What's the best energy hormone? It's testosterone in women. Doctor, my skin is getting so thin and paper-like. What's going on? Well, that's because you lose testosterone. It's Good for aesthetics. The cosmetic surgeons use it to help improve skin thickness and to maintain less wrinkles. It's important for body composition. As you're younger, more women have muscles. When you get old, you lose the muscle and you start to bulge down below. So there's a reversal of body composition when you lose testosterone. It's the best hormone for skin. It's the best hormone for muscle and structure. Women undergo what's called sarcopenia. Sarcopenia is loss of muscle. What happens when you lose muscle? You lose metabolism. What happens when you lose metabolism? You gain fat. The way to get rid of the fat is increase the testosterone, which increases the muscle mass, which increases the metabolism, which then burns the fat. It's good for structure, it's good for skin, it's good for body composition. Women that are on testosterone say what a difference it has made in their lives. It's the least prescribed hormone and the least appreciated by, because the drug companies don't make it so that we can prescribe it. You have to have it dispensed from a special pharmacy called a compounding pharmacy. Those feel-good effects, remember, it's not just a male hormone, it is a beneficial female hormone too. It's the second best hormone for metabolism. Thyroid is the best one for metabolism. I'll get to that in a minute. It's the best hormone for libido and sexual function in both men and women. Many of you have gone to your doctor and said, I'm cold, tired, fatigued, I need thyroid. Your doctors say your thyroid level is normal. The patient says, no, it's not. Your doctors say, yes, it is. The patients say, but I think I would feel so much better on thyroid. We doctors say, your level's normal, you don't need it. You continue to search someone that finds that, yes, there is a beneficial effect of thyroid in helping to make you feel better and function better. The goal of bioidentical hormone therapy is to replace our hormone levels back to optimal and not just normal. Normal is not optimal. Normal is where you are for your age. Optimal is where you were when you were 20. Medical literature says optimal is where you have to be to see a change and to feel the difference. Normal is not accepted by us. Only optimal is. We take thyroid and bring it back to optimal levels just like we do estrogen, progesterone, testosterone, and DHEA. All hormones are beneficial. It's only low levels of hormones that are harmful. And thyroid is no different. It is a beneficial hormone for a multitude of reasons, health-wise and feel-good-wise. Typical symptoms: cold, tired, fatigued, thin nails, thin skin, thin hair. Many women after age 50 will lose their hair. We don't know why. We think, it's got to be those hormones. I went into menopause and then I started to lose it. The only way to get that hair back is with thyroid. Bringing it back to optimal helps repair hair, skin, and nails. It helps decrease weight gain and the fat gain and the increased cholesterol as we get older. I eat the same, I exercise the same, but these changes are occurring. Why? Because